Thank you so much for watching On Call for All Kids. Today, we're going to be talking about everything you need to know about kids going back to school during the COVID-19 pandemic. We'll be discussing what schools should do to make it safer for kids, what to do if a child with COVID-19 comes to school, and how to choose between in-person or online education. I'm joined by Dr. Allison Messina. She is the chief of the Division of Infectious Diseases at Johns Hopkins All-Children's Hospital. And she also serves on the medical advisory group in the reopening task force for Pinellas County Schools. So Dr. Messina, you've been so busy.
Yeah, absolutely. It's been a super busy time of year.
So let's get right into it. What should schools really be doing to make it a safer place for our kiddos as they head back to school?
Well, I'm glad you asked. So the most important thing to realize is that school is going to look a little bit different this year. 6 months into this pandemic, we do have a lot of data and information about things that we can do to keep each other safe in public spaces. Probably the first and most important thing is universal masking. Kids are going to be going to school with masks on, and teachers and staff as well. And this is very important because we do know that this stops the spread to some degree of COVID-19. And it keeps people a lot safer, especially when they have to be close together. The next thing is physical distancing. We've seen it in stores and in the public, and you'll see it in schools as well. The schools have done a phenomenal job of reorganizing desks and spaces and things within the school building to try to keep kids as physically separated as possible to decrease the spread of disease. The next thing is availability of hand sanitizer and sinks and soap to wash those hands very, very frequently, because we know that shared surfaces can sometimes be the vector of transmitting disease as well. So schools are going to look a little different as the fall time comes around. And it's important for parents to realize the strides that have been made and to help your kids adhere to these things because they really are in the interest of your child's health.
What happens if a kid comes to school and they do have COVID-19? I'm sure this would be very alarming to many parents.
Yeah, definitely. And as much spread as we're seeing in the community these days, this is unfortunately bound to happen. Somebody is going to come to school, whether it be a student or faculty member with COVID-19, whether they know it or not, of course, because a lot of times kids especially will not have any symptoms even of this disease and still may be present in school. So when a child is identified as being positive for COVID, the school and the public health department will work together to try to identify what we call high-risk contacts. And these are people that have maybe been around in close quarters with the person who tested positive. And those individuals will be identified and asked to quarantine for 14 days. And what that means is that they will be home from school and not interacting with the public while they wait out that time to see if they develop symptoms. If at the end of those 14 days they are not sick, then they can come back. So we will probably see this happen in schools. The schools are prepared for this. Many schools have created ways so that healthy kids that are waiting out their quarantines at home will still be able to learn online while that happens. But this is something that the schools have thought long and hard about so that kids don't lose that educational piece of their school experience while they're waiting out a quarantine.
Yeah, it's a really fluid situation, and it's going to take a lot of flexibility, I think, from everyone involved, from parents to teachers, and then students, of course, as well. You mentioned online, so a lot of school districts are offering online version of school, and then some are saying, yes, you may come back in person. wearing masks, physical distancing, this sort of thing. How do we know which is right for our family?
So that's a great question. And of course, it's going to be an individual decision for every family and for every student. Some of the things to consider from a health aspect are, is your child at risk of more severe disease with COVID should he or she get sick with this virus? Some of the things that we know put people at higher risk of more severe disease are underlying conditions such as heart disease, lung disease, diabetes, etc. If you have any questions about whether or not your child has one of these high risk conditions, it's best to talk with your pediatrician before school starts and talk about which option is safe for your child. The other thing, however, from an educational side to consider is how well the child learns. Some children might be more amenable to learning online, to staying on task. And some children really do learn best with a more rigid school structure, like a very structured day, which might mean that they would do better in person. So a lot of things go into weighing these decisions. There's also, the question of, do parents need to work, and is there supervision, especially for young children that are going to potentially stay home and learn all day? Those children still need someone to be there if they're too young to take care of themselves. So all of these things need to be factored in before making that decision.
Yeah, lots to consider. Lastly, are there anything that parents can be doing right now to sort of help prepare, set those expectations with their children at this time before school starts?
Yeah, absolutely. So wearing masks all day is going to be quite a change. It's not something that probably most kids are used to doing all day long. So getting them used to wearing the mask is probably the biggest thing that parents can do to try to prepare them for school. The other things that parents can do is to be good role models. Let your children see you wear a mask, and so that they know that this is expected and it normalizes the behavior for them. They will also need to know how to wash their hands. And probably this is the one thing that students might not realize has to be done probably a lot more than they've ever done that before. Typically, kids are not great about washing hands. And a lot of times they will know to do it maybe before eating or after using the restroom. But now they need to be taught that maybe there are other instances during the day where this needs to be done, like after touching doorknobs, after touching shared surfaces, things like that. And it's going to be most convenient for kids probably to use hand sanitizer in a lot of these circumstances. So teaching your kids how to use hand sanitizer is important, especially if they're little. They need to know to cover the surface of their entire hands with it. They need to know not to put their hands in their mouth. They need to know not to put it near their nose. So these are kinds of things that the parents can prepare kids for at home before they go to school.
All right, Dr. Messina, thank you so much for joining us. We know how busy you are, and we really appreciate everything you're doing to help keep our community and our kids safe.
You're welcome.
And thank you, everyone, for watching today's On Call for All Kids. We hope you learned a lot as you're preparing for back to school. If you have any topics or ideas you would like us to look into, you can comment below right here on this video. And you can also visit our website. It's HopkinsAllChildren'sHospital.org/coronavirus, and you'll find many more resources there as well. We'll see you next time. Thanks for watching.